I've been interested since around 16 years, when I was about 16 years old, because at that time they started, the intuitive system started went from DARPA towards the real surgical, like clinical surgical side. Um, and my own background is actually in engineering, so I went into engineering, and then I switched my degree. I finished the engineering degree, and I went into medical school. And during urology, during my first internship in surgery, I said, "Whoa, this is really I want to do surgery, and if possible, specialize in robotics, because for me it's the summum of technology, whilst that improves patient care, because it's doing real robotics, and in the meantime helping patients, helping people that have serious problems that can impact their lifespan significantly." So for me it was both the caring side together with the technology side that for me was the perfect wedding, actually. How I came to my position as the head of innovation at Orsi Academy, which is the position that I currently hold. While I was in my surgical residency, I was in the hospital of Alex Motri, and we jumped into each other. Well, we bumped into each other, or basically I bumped into him, because everybody knows him, and I was very fascinated to combine my technical background and my clinical background. And he said, "Look," he saw some of my previous work, and he said, "Why don't you come to Orsi and we have a talk?" And that was 6-ish years ago, and since then it has been non-stop under his guidance that we were able to build a team to really tackle real clinical challenges from a technical perspective using innovation. And without his mentorship, I wouldn't be nowhere near to where I am today, because he's an excellent surgeon but also an excellent innovator. And then along the course, I also had other excellent mentors, excellent academic professors, Professor de Kasteker, for instance, who was somewhat younger, but who also had a straight vision on how he wants to see technology, and is doing very expert pushing the robotic surgery field. So I had this point where Alex Motri is a visionary surgeon with a lot of expertise, with a lot of industry connections, and then I had these clinical mentors that allow you to basically combine and to get stronger on both aspects. And I think today is like the nice example of how innovation through Orsi Academy can push forward societal change and can impact healthcare as such. So I'm very happy, thanks to him, that I can contribute to this. You can only get good at mastering this complex technology if you get a good training and a good education, and it's something we still lack. And part of it is technical innovation, but part of it is really educational innovation. And I think the methodology that was developed at Orsi using the proficiency-based progression methodology with Professor Gallagher, in which we try to break down surgeries into small steps and focus on what you should not do, rather than I was taught as, look, this is what you should do, but you're never taught at what you should not do, or what is actually the worst thing that could go wrong, or what you should prevent, which is actually what you should know. And I think this is a revolutionary change that is now happening inside of our medical education, and it's very nice to see how the team at Orsi is pushing this wagon to try and get it into the right direction. It's a lot of hard work, and we're definitely not there yet for all types of surgery, but we're getting close for robotics to finishing task by task and to really getting systematic evidence and systematic pushes on medical education. And it's clear that the farmhouse for that is too small. So I was very happy to come to Orsi when the new site was just opened. We are still with our innovation team using all facilities, because we are actually again saturated in capacity. So again, we want to expand and keep on growing because of the demand of the clinicians, that there is a need for evidence-based and structured training.
I think 15 years ago we met, and at that time, desperately, Alex and his institution, we want to get into robotic surgery. We having some limitations how we want to do, and just over the dinner, we all decided, let's do it somehow. So we became partners, and it's been a very successful. And I give a lot of credit to Alex and his team.
I would really like to thank Mr. Vattikuti for his efforts in seeing this societal change, and congratulate Dr. Bandari for the way he is leading this effort through the Vattikuti Foundation. Because if you see what we have together here today in these days, it's really the key opinion leaders. We just had 2 sessions on artificial intelligence. It's really the people pushing the field in the clinical field. So they're not from an ivory tower in research. No, they're also in hospitals, and they're also there. It's the AI work or the innovation work on the ground, not purely technical that will only impact clinical practice in 10 years or in 15 years or very preclinical. No, it's what is happening today and what can we do. What if you enter a hospital today, what does AI mean, for instance? We have other sessions on other types of technology. But I think the top-notch faculty is one thing, and the way that the talks are explained, so that for a layman, and then for this I mean expert clinicians who do not know about these new technologies yet, they're able to get a grasp of this technology, and I think that's a very nice part of this symposium. Apart from the lovely city of Ghent, which I of course endorse because I've been here for quite a lot of time. So error prevention and knowing what your errors are is crucial. In my opinion, part of innovating is just trying. It's trying, failing. Oftentimes it's more failing than succeeding. But if you try and you try again, sometimes the dice just hits the right direction and you go into the next step. And I think a lot of the people here and in the open conversations as well facilitate that. You don't always know exactly the direction where you're going. You know that this is your end goal, but the path there can go in all directions. And I think this type of discussions that you can have here and seeing each other's pains to get there and how you succeeded. This is also good to inspire new and younger people. We had the junior organizations here as well to see, look, it's not always as bright, the innovation story. There's a lot of hard work and a lot of failures behind the scenes as well. And I think this is important to motivate young people. It's not just a shiny show of new technology. There's a lot of things in the back that before you ended up in that point. And I think that's also an important point to make. So where does the future go? I'm very optimistic because it's our duty as innovators to say that the future will entail help and automated assistance in surgery. And I think automated assistance is probably one of the first steps in robotic surgery that we will have. So in my case, that's where the next 5 years go. After that, nobody knows. But we'll maybe have this discussion in 5 years, and then we can review and see if it was at some point corrective or what do we entail. But the only way to know is in trying and keep on pushing, I think. I'm grateful for and where I think things would go and can go, and I think I hope that we can keep pushing with Vattikuti together to lead the field where things go in the future of robotic surgery, because I think there's a lot of illiteracy, and that's something that I really want to focus on in the next couple of years. It's really the societal change for robotics. It's really how can we also train people that are not so lucky as us, meaning in other parts of the world where they don't have a robotic OR at every corner. How can we train them? How can we give these people opportunities to learn? And I think artificial intelligence there will have a very big role, because it will enable us not to travel the world, but to remotely train these people at some basic landmarks and basic steps. And I think it's also a responsibility. We are lucky that we are here and that I'm from the region of Ghent, but not everybody has that fortune, and there's brilliant minds all over the world that can push this field, I think, a lot further, but we have to empower them and enable them. And I think that's something we really try to do, but where we still need to do a lot of work.